This dog spun in circles like this for 3 months. The owners filmed it on video and laughed. But then there was an MRI. Veterinarians say that circling is one of the most alarming things they see during an appointment, and not just because it looks scary. The real issue is that people come to them far too late. You laugh, you record it, and you send it to a group chat. However, there are several reasons for this circling behavior, and some of them simply cannot wait. First, we need to separate two entirely different things. A puppy circling before sleep is just trampling the grass like its ancestors did in the wild. A dog might also circle while choosing a spot, orienting itself by the Earth's magnetic field, which is a documented fact. When a dog chases its tail in play, there is a clear beginning, an end, and a playful sparkle in its eyes. Those behaviors are completely normal. But there is another kind of circling that is compulsive and repetitive, strictly moving in one direction, either clockwise or counterclockwise. Sometimes it comes with a vacant stare where there is absolutely no eye contact with you. Other times it ends with disorientation, where the dog stops and has no idea where it is. This right here is a clear signal. It points to things that nobody ever talks about in those funny dog videos. Vestibular syndrome is the very first thing a veterinarian checks for when they see a dog that circles without stopping. The vestibular system is what keeps your dog balanced in space. The inner ear and specific receptors send signals to the brain, telling the dog if it is straight, leaning, or moving to the right. When this system malfunctions, the world inside the dog's head literally begins to spin, meaning it does not choose to circle. The dog is simply trying to cope with the feeling that the floor is slipping out from under its paws. Acute vestibular syndrome looks terrifying. The dog suddenly loses its balance, its head tilts to the side, and its eyes begin to move involuntarily from side to side, which is known as nystagmus, often causing the dog to fall. The dog circles because it simply cannot maintain movement in a straight line, making owners usually think it is a stroke and the end is near. Here is the unexpected part. Idiopathic vestibular syndrome, which is the most frequent form, resolves on its own in most dogs within 1 or 2 weeks. However, this definitely does not mean you should just wait it out. This urgency is because the exact same symptoms can be caused by a tumor, middle ear inflammation, a polyp, or brain damage. On the outside, they all look exactly the same. Only a specialist with the proper equipment can see the difference, not a video on a phone or an online owner's forum. Infections of the middle and inner ear are the most common cause of circling that gets completely missed during home diagnostics. Middle ear inflammation puts pressure on the vestibular apparatus, causing the signals from the left and right ears to contradict each other. The brain no longer understands which way is up, causing the dog to spin in circles. At the same time, there might be absolutely no outward signs, like no bad smell, no discharge, and no discomfort when you inspect the outer ear. The inflammation is hidden deep inside, exactly where the owner cannot see and where a cotton swab cannot reach. With the right treatment, including antibiotics, anti-inflammatory drugs, and sometimes surgery, middle ear infections are fully reversible. However, a neglected infection spreads to the inner ear, damages the facial nerve, and sometimes even reaches the lining of the brain. The difference between catching it in time and waiting is sometimes preserved hearing for the rest of the dog's life or losing it entirely. There are owners who go to the veterinarian after a week, and there are those who wait 3 months, which can sometimes be the difference between needing an expensive surgery or not. Sometimes it literally means the difference between a living dog and a dead one. The owner of a 5-year-old Labrador noticed that he started occasionally walking in circles in the kitchen. He would do 3 or 4 rotations and then stop, so she assumed he was just looking for something, smelling food, or fooling around. 2 months later, the circles became much longer. He would start spinning and could not stop on his own, eventually bumping into furniture exclusively on his right side. It was as if he did not even notice the furniture was there. She finally went to the veterinarian when he collapsed during a turn one day. An MRI revealed a meningioma, which is a benign tumor of the brain linings, located in the left frontal lobe. This explained why he ignored the space on his right, as a lesion in the left hemisphere produces symptoms on the opposite side. The tumor was successfully removed, and the dog survived. A year later, the veterinarian wrote to the owner and received a photo showing the dog running around, well-oriented and alive. But what she admitted at that very first appointment is chilling. She had thought it was funny. For 2 whole months, she genuinely believed it was just a funny quirk. Rotational behavior syndrome moves us into the realm of neurology, and this is where we discuss things that are mentioned even less frequently. Compulsive circling is actually one of the manifestations of obsessive-compulsive disorder in dogs, and yes, it really does exist. The underlying mechanism is exactly the same as in a human with OCD, where the brain gets stuck in a loop that it cannot break. The dog does not choose to do this, it simply cannot help but do it. Most often, this develops in animals that have lived in conditions of chronic stress, such as small spaces, isolation, or situations with no escape. Shelters, cages, or rooms they were never let out of force the brain, which has nowhere else to go, to create a behavioral loop as an emergency release valve. Eventually, this valve stops being an emergency measure and becomes the only operating mode. Certain breeds are more strongly predisposed to this, including Bull Terriers, Dobermans, and German Shepherds. This is not a flaw in them, but rather their heightened risk under specific adverse conditions. Fortunately, this condition is treatable through behavioral correction, environmental enrichment, and in severe cases, medical support. But the crucial first step is to recognize that this is not just a funny habit. When people say the words epileptic seizure, they typically picture convulsions, foaming at the mouth, and sudden collapsing. That classic presentation is obvious, and you simply cannot miss it. However, there are also focal seizures that affect only a specific part of the brain and look entirely different. During a focal seizure, a dog might just stand completely still and stare blankly at a single point, lick its lips rhythmically, or start circling. It might circle monotonously, strictly in one direction, with completely lifeless eyes. This episode could last for just a few seconds or go on for several minutes. Once it stops, the dog will be disoriented and exhausted, acting as if it just returned from somewhere very far away. This is known as the post-ictal state, which is the post-seizure recovery phase. Owners miss focal seizures for years simply because there is no classic picture to recognize. They film this funny behavior, completely unaware that they are documenting a severe neurological episode. This condition can only be diagnosed with an EEG and an MRI, but only if you actually take your dog to a doctor. We also need to talk directly about brain tumors. One of the very first symptoms that owners of dogs with brain tumors report is a change in behavior, specifically circling or walking in circles. This is accompanied by a constant head tilt to one side and a loss of orientation in familiar spaces. The dog might suddenly be unable to find its bowl or start bumping into familiar pieces of furniture. A tumor in certain areas, like the frontal lobe, cerebellum, or brainstem, literally alters how the dog perceives space and controls its movements. She does not choose to spin, she simply has no other choice. Most often, this tragic scenario unfolds in older dogs. Boxers, golden retrievers, and German shepherds are statistically in the high-risk zone after reaching 7 years of age. Veterinarians hear the exact same story over and over. The owner comes in and says the dog has been spinning for the last 3 months, and they just thought it would get used to it. 3 entire months went by where the tumor was steadily growing while the owner waited for it to magically disappear on its own. Another cause is hypothyroidism, since the thyroid gland manages the body's metabolism, including the metabolism of the nervous system. When there is a thyroxine deficiency, the peripheral nervous system suffers significantly. The dog becomes lethargic, gains weight, feels cold, and develops ataxia, which is a loss of coordination. This lack of coordination also causes circling, which owners often write off by saying the dog is just being weird. Thankfully, this condition is completely reversible with hormone replacement therapy. Within a few weeks of treatment, the dog typically returns to its normal self. However, identifying this requires a blood test, which no one ever prescribes for themselves at home. After hearing all of this, the most important takeaway is that circling is a symptom, not a character trait, a breed feature, or just how the dog is. It is a serious symptom that has an underlying cause. And that hidden cause continues to develop and worsen while you sit and wait. You must carefully observe the pattern of the behavior. Moving in only one direction almost always indicates a one-sided lesion. If it is accompanied by a head tilt, the problem is likely the vestibular apparatus or the ear. If there is subsequent lethargy and disorientation, you might be looking at an epileptic episode. If this happens to an older dog that has never experienced it before, a thorough neurological examination is absolutely mandatory. You should record every single episode on video, not for social media likes, but for your veterinarian. A video showing the real behavioral picture gives the doctor vital information that no verbal description could ever replace. If your dog is spinning in circles, do not wait for it to happen again. Do not wait until the weekend rolls around. Record a video right now and call your veterinarian today. The Labrador from that earlier story survived, but his owner came in later than she should have. It was not much later, but it was still dangerously delayed. Write in the comments below if this has ever happened to your dog and what the final diagnosis turned out to be. If you want to learn about other symptoms we mistake for strange habits that are actually warning signals, be sure to subscribe. The next episode will be all about why a dog shakes its head and when it stops being just a simple shake.